Linezolid, also known as Zyvox, is an antibiotic used to treat serious bacterial infections. It works by stopping the growth of bacteria. It's important to note that this antibiotic only treats bacterial infections and will not work for viral infections like the common cold or flu. Using any antibiotic when it's not needed can cause it to not work for future infections. Zyvox also belongs to a class of drugs known as MAO inhibitors, which can increase the levels of certain natural substances in the body, such as dopamine, norepinephrine, and serotonin. This can increase the chance of certain side effects and food and drug interactions. It's important to follow the prescribed dosage and take Zyvox at the same time each day to maintain a consistent level in your body. Be sure to check with your healthcare provider for the optimal timing for taking this medication. When taking Zyvox, it's important to follow your doctor's instructions on when and how to take it. Usually, it's taken every 12 hours, with or without food. The dosage depends on your medical condition and response to treatment. For children, the dosage is based on age and weight, and they may be directed to take it every 8 hours. To prevent a serious high blood pressure reaction, you'll need to follow a special diet to limit your intake of tyramine while taking Zyvox. This means avoiding foods and beverages high in tyramine, such as aged cheeses, dried/aged meats, preserved fish, yeast-containing products, fermented foods, soybean products, certain beans, and certain alcoholic beverages. Consult your doctor or dietitian for a complete list of foods to limit or avoid. For the best effect, take this antibiotic at the same times every day. This will help you remember and keep the medication at a consistent level in your body. It's important to continue taking Zyvox until the full prescribed amount is finished, even if your symptoms disappear. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, be sure to tell your doctor. Possible side effects of Zyvox include diarrhea, headache, nausea, vomiting, or dizziness. If any of these effects persist or worsen, notify your doctor or pharmacist immediately. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of side effects. Most people using Zyvox do not experience serious side effects, but it's important to contact your doctor immediately if you experience symptoms such as deep or fast breathing, unusual drowsiness, persistent nausea or vomiting, numbness or tingling of the hands or feet, unusual tiredness, or easy bruising or bleeding. Be sure to seek medical help right away if you experience severe side effects such as muscle stiffness, increased sweating, vision changes, mental or mood changes, or seizures. Zyvox may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal or stomach pain, or blood or mucus in your stool, contact your doctor immediately. Avoid using anti-diarrhea or opioid products if you experience these symptoms, as they may make them worse. Prolonged or repeated use of Zyvox may result in oral thrush or a new yeast infection, so contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. Contact your doctor immediately if you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, unexplained fever, severe nausea, vomiting, or diarrhea, twitching muscles, or unusual agitation/restlessness. Zyvox may rarely cause an attack of extremely high blood pressure, hypertensive crisis, which may be fatal. Contact your doctor immediately if you experience symptoms such as severe headache, changes in heartbeat, chest pain, neck stiffness or soreness, severe nausea or vomiting, sweating with fever, widened pupils, vision changes, or sudden sensitivity to light. In rare cases, a serious allergic reaction to Zyvox may occur. Seek medical help right away if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Before taking Zyvox, make sure to inform your doctor or pharmacist about any allergies you have or any inactive ingredients that may cause allergic reactions. Also, discuss your medical history, including high blood pressure, blood/bone marrow problems, kidney problems, liver problems, certain tumor conditions, overactive thyroid, seizures, and diabetes. Zyvox may make you dizzy, so avoid alcohol or marijuana while taking it. If you have diabetes, monitor your blood sugar regularly and report any symptoms of low blood sugar to your doctor. Zyvox may also affect the effectiveness of live bacterial vaccines, so inform your healthcare professional before getting any immunizations. Before undergoing surgery, let your doctor or dentist know about all the medications and products you are using. If you are pregnant, use Zyvox only when necessary and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using Zyvox. Make sure to check the How to Use section for more information. It's important to be aware of any drug interactions that may occur with Zyvox, as they can affect how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. It's essential to get their approval before starting, stopping, or changing the dosage of any medications. Zyvox may interact with a variety of drugs, including diet pills, ADHD medications, certain pain relievers, supplements, and antidepressants. It's crucial to inform your doctor and pharmacist about any medications you are currently taking or have recently taken, as these interactions can occur even weeks before or after taking Zyvox. In addition, you should avoid taking other MAO inhibitors with Zyvox, as this can cause a serious and possibly fatal drug interaction. It's important to consult your doctor before starting or stopping any medications in order to avoid any potential risks. Lastly, it's important to report the use of any drugs or herbal products that may increase the risk of high blood pressure when combined with Zyvox, as this can lead to a hypertensive crisis. Always consult your doctor or pharmacist for more information and to ensure the safe use of Zyvox. If you or someone else has taken too much Zyvox and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others, as it has been prescribed specifically for your current condition. Do not use it later for another infection unless directed by your doctor. While taking Zyvox, you may need to undergo lab and/or medical tests such as complete blood count and blood sodium levels. If you take Linezolid for 3 months or more, or experience vision changes, it's important to have regular eye tests. Be sure to keep all medical and lab appointments to monitor your health. If you happen to forget to take a dose of Zyvox, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next one at the usual time. Don't take a double dose to make up for the missed one. It's important to store Zyvox at room temperature, away from light and moisture. Don't store it in the bathroom, and always keep it away from children and pets. If you no longer need the medication or it has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.